As Matt said, this is David Edmondson, and I have the pleasure of serving as the Global Healthcare Team Leader. On the program today, I'm joined by Matthew Hine from the Office of Health and Information Technologies, which is part of Industry Analysis. We're also joined by Marta Hausmann out of CS Austria. And finally, we had the opportunity to hear and learn from a fantastic client and health IT company with Robin Wiener of Get Real Health. For the rest of the hour, we will do our best to provide information surrounding the healthcare team and the health IT industry as a whole. I'm going to start with some basic background on the healthcare team. From there, Matthew is going to provide a 30,000-foot overview of health IT as a whole, kind of some big picture industry stuff. We'll then plan on digging a little bit deeper with a focus on all things Europe, and that will be covered by Marta. And then finally, Robin's going to go into a real-world example of how a health IT company approaches international markets. So before we get too far into the IT side of things for the healthcare industry, I'd like to provide some high-level team information for those that might be new to the healthcare team as a whole. Many of you likely have colleagues on the team, as we are one of the largest ITA industry teams. Currently, we have just over 300 members from across ITA, with members from ODO, OIO, INA, Country Desk, Select USA, Advocacy, and other relevant offices. As a team, we represent a massively important industry. I know I'm a little biased with that viewpoint, but I think it's very, very important. A few key stats include the world market for medical products is currently valued at an estimated little over $1.5 trillion. The global medical products market is forecast to grow 25% to just under $2 trillion by 2023. And currently, healthcare accounts for 16% of the U.S. labor force, 11% of the economy, and 10% of exports. As a team, and in my role as a team leader, I go about my business by trying to organize opportunities and coordinate the way information is communicated to bring value to members no matter where they are in the engagement spectrum. With regard to health IT and all sub-industries in general, my goal is to provide a pathway for those who wish to become true experts in the sector, while at the same time providing easy-to-use and digestible resources for those that are only able to dabble in health IT or healthcare in general. So a little bit more about the overall team structure. As a team, we actually cover 12 specific subsectors, which you see here, many of which have existing internal champions who are spearheading specific subsector engagement. In terms of subsectors, I'm pleased to report that health IT is a specific area where there are already several team members that are highly engaged, highly experienced, and have a wealth of knowledge that can share with the rest of the team. For healthcare in general, the number one way to learn more about the industry, current opportunities, is essentially just to join our email list and join the team. If you aren't currently on this list and would like to be, the easiest way to go about this is to send me an email of interest. Once on the list, we promise you're not going to receive a large number of emails, but rather one consolidated email a week from me every Tuesday, which I affectionately call the Global Healthcare Update. This update has two basic principles to it. The first one being internal news and info, which is a consolidation of team news, industry news, market intelligence, and ways to further connect with the team. Finally, it's worth subscribing to for the Healthcare Team Quote of the Week, which is a motivational offering that will be motivational or at the very least make you smile. Today I actually quoted Dr. Seuss. In the past, I've quoted athletes, past presidents, and the occasional pop culture reference. A few weeks ago, I actually quoted Taylor Swift, which was universally beloved. The Global Healthcare Update also covers external events and opportunities, which is a chronological listing of team events and current trade leads that can be shared with you as clients during client counseling. This section is written in a way that individual events on the whole can be easily shared, or kind of the entire listing of all things healthcare in an easy copy-paste fashion. For those actively counseling healthcare clients, other resources to be aware of include our monthly team newsletter and our healthcare resource guide. The 2019-2020 version of the guide was actually just recently uploaded to our teamexport.gov page and includes around 70 specific market reports, with each report providing details on things such as market entry, current market trends, main competitors, current demand, registration process, reimbursement, barriers, procurement and tenders, local associations, frequently asked questions, and some statistical snapshots of each of the international market areas that we have offices in. Finally, my closing comment is that if you have questions or are looking to get further involved with Health IT or the team in general, simply put, we'd love to hear from you. And with that, I'll hand it over to Matthew Hine, who will share more about Health IT as a whole. So Matthew, I'll hand it over to you.
Thank you, David, and thank you for the opportunity to speak to everyone today. I'll jump in here to advance the slides. So I'm Matthew Hine. I'm a Senior International Trade Specialist in the Office of Health and Information Technologies here at headquarters in Washington. And thank you all for joining our webinar today to learn a little bit more about the health IT sector. In our office, we have 3 people. We're a team of 6 at the present. We'll be adding a 7th person in a week or so, and an 8th person may be coming soon. But right now, Jennifer Boger is our health team lead, who oversees all the sectors we follow in our office, which include biopharmaceuticals, medical devices, health services, and this place where IT and health intersect, which we'll talk about in this session. When I started in this office back in 2005, I was asked to do about 3 or 4 different things, and kind of as a throwaway line, the office director at the time said, "Oh, there's this health IT thing going on. Maybe you should go check that out." And it's just a fascinating sector as well. And as we get into this, I'm going to highlight particularly the fact that this is really a very multifaceted sector. There's a lot of different component parts to it, and I think clients don't necessarily understand or it's all that well understood as to how complex this sector is and where different stakeholders interact with each other as relation to that. And I think Robin, who we will be hearing from a little bit later, is a company who's a great example of how you take a look at this sector, and there's a lot of things that are very specific to this sector that have evolved over the years. So I've lead on the health IT strategy and direction in the office, mainly focusing on Europe and Western Hemisphere and Africa. Selena Milligan, who's in the office next door, leads on Middle East and Asia for our health IT work. So when you take a look, this is a definition that comes from the Office of the National Coordinator for Health IT, which is housed in the Health and Human Services department here in the U.S. government. And it's a very broad-based definition, and there are plenty of definitions that are out there. But what's interesting is that it talks about both computer hardware and software that deals with the storage, retrieval, sharing, and use of healthcare information, data, and knowledge for communication and decision-making, as you see. And within storage, there are particular issues that both work from a policy and a marketing, market opportunity perspective, retrieval of information, verification of data, how you use healthcare to make decisions, and a lot of these things all have component parts that do interact with each other. Sometimes you'll hear in reference to health IT that it helps meet what's known as the triple aim. It's actually in some quarters now called the quadruple aim, but it's to look at both improving care quality, safety, and patient experience. So what type of treatment do patients get, and how can health IT assist with that? How does it help enhance population health, not just for one individual, but across many groups of people, whether you're looking at it from a disease state, from a geographic region, for those types of basics, and of course the fact that there's a very high healthcare costs is a large expenditure for many governments, and they're always trying to look to manage those costs. The thing that's interesting is that these are things that initiated in the U.S. market, but countries around the world are all dealing with the same things. And just as a note, that when you do hear the reference to the quadruple aim, the fourth part is taking a look at healthcare providers and how health IT can help simplify their lives and not add additional burden to them. So that's kind of a good reference point as we get into taking a look at what's in the sector. And apologies for the slightly small type of this, but in 2004, President George W. Bush signed an executive order that said every American will have an electronic health record within 10 years. So a lot of effort in the early years focused on electronic health records, which both are personal health records, the ones that you and I can manage, or electronic health records, which often are managed by hospitals, clinics, physicians, and so forth. But as time has gone along, there's been an increased focus and attention on many other component parts of health IT. And you can see many of them here on this chart. I'll just touch on a couple of those. Telemedicine is at the 6 o'clock in the circle, is one of the ones that we have been focusing on quite a bit because it is this interaction between why do you need to visit a doctor in person where you can get some care maybe done in a safe, controlled, patient-centric environment remotely. And that could be 5 miles from you or 5,000 miles from you. It's something that should allow for doctors who have knowledge of specialized conditions or can treat people in remote areas to be able to get the health care that they need in a timely fashion to address their health condition. At the 1 o'clock, you can see consumer wearables, which they show the kind of the Fitbit or the Apple Watch, smartwatch or things like that. That's definitely a cutting-edge area where it's both that intersection of product and service. How you get that information, how do you use that information, can you share that information with your healthcare provider or hospital or physician to help you get a better sense of what you are going to be getting in terms of your healthcare and make sure that it's timely. Electronic prescriptions, that's pretty common now. You could do those sorts of things online in most places, but that's not always a common thing you can find internationally. So how do we help get some of those solutions that the United States has adopted to become much more evident internationally? And one other thing I'll say before moving off of this slide is that whatever country you are speaking to, they probably can use some piece of health IT. At the 9 o'clock, you see text messaging or email. Well, even if you're getting a text message to somebody that says, take your medicine, or you're due for a doctor's appointment. Those sorts of things are health IT, maybe in some ways a much more basic form of it. But I think that regardless of whatever condition your clients are taking a look at or whatever markets they're taking a look at, there's probably some place where their healthcare-based solution can have an impact. And it should be noted that there are lots of non-traditional players now entering the health IT market, and we'll touch on that a little bit later on. When INA started looking at this, we were still known as Manufacturing and Services at the time. It was quickly recognized that health IT covers health services, health products, and ICT. So in the early days, we had representatives from all three of those offices in industry and now in MAS at the time, now INA, who played a role in helping us to understand what's happening with hospital services or health services. That was not my area of specialty, but Steve Miller, who many of you may know, who's now in Select USA, handled that. I'm not an ICT specialist, far from it, but Fred Aziz, who is in the Office of Technology and E-Commerce, who now is in the commercial service, handled that area very well for us. And the three of us learned a lot from each other about how the different pieces of this sector interact. It actually was Fred who helped introduce us to Robin Wiener, who you'll be hearing from a little bit later. But as you see on this slide, there's lots of different component parts to the industry: medical devices, software, education, training, as the product sorts of things. And then there are standards, interoperability, and newer areas such as artificial intelligence that also impact what's going on with health IT. So what did we do in our office to try to help with understanding what's happening in the sector? We gather intelligence on health IT sectoral trends. We did a top market report. So I did a couple of those, which you can find on the top markets report website. We try to take a look at the policy challenges that companies face and address those. I think that that's going to be an area where we think there's a lot of opportunity and a lot of challenges that companies are not conveying to us that we need to hear from them. We need to hear this a lot more readily from your companies, your clients who are out there. I think that will help with market access for many companies who are out there. And of course, the issues of tenders, procurements, and other export opportunities. How do we publicize those a bit more widely? How do we make sure that companies know about these things and can act upon them, whether individually or in a consortia type situation? So when you take a look at some of the data, and David touched on a little bit of this, the numbers are really quite large. When you take a look at global healthcare spending, it's expected to reach over almost $9 trillion next year. This is a number that came from The Economist and Deloitte last year or the year before. And I know the United States spends $3.5 trillion of that, roughly, according to HHS. But even so, that's $5 trillion plus that is handled by the Brazilians or the Chinese or the Russians or the Indians or the Kenyans. So that should lead to a lot of opportunities for companies in this sector to leverage that. The sector as measured, there's some variability in those numbers simply because people sometimes will include parts of the industry as being in scope and others will be considering it not in scope, and differing opinions as to how fast the sector is growing. But even if we can agree on, say, $100 billion to be a good rough number for sector size in 2018, that's a very sizable market. And quite a bit of that's overseas, and quite a bit of that is open for U.S. companies to be able to do that business. It helps at the moment that there are not that many local champions in other countries doing a lot of the things that we are doing here. That's a good thing that we need to take advantage of and leverage. Quite a bit of that happens in Europe, and I think Marta will talk a bit about that. But countries, again, at all stages of health system development can implement some form of health IT, whether it's text messaging or something a bit more elaborate. And the last figure is interesting. Employment data is hard to get hands on because there's so many different component parts. But the Bureau of Labor Statistics came out with data in 2016 in just medical records and health information technicians that's over 200,000 people. And that number is growing at a pretty fast rate. 13% is much faster than most other sectors are growing, so there definitely is demand there. Couple of slides to go in my section before handing it off to Marta. There's several major trade associations that we deal with in the sector. Healthcare Information and Management Systems Society, or HIMSS, is one you may have heard of. They do a very large conference, which ITA has had a pretty good sized presence in the last 8 years or so. We are hopefully, and David, please jump in to correct, we're hopefully going to have a TEP with them for this conference, which is actually a pretty significant milestone since they were not an IFC, IBP, a TFC, or any of the other acronyms that we use for trade shows. AdvaMed, who does a lot with medical devices, also has a digital health working group. We've been having some discussions with them. American Health Information Management Association does a lot with health information data. How do you look at the quality of the data? How do you train people to use the data? How do you interpret the data? We have had some good interactions with them in the past. We actually had a market development cooperator program with them about 3 to 5 years ago, and this office managed that. And we're re-engaging with them now. American Telemedicine Association focuses on that subset of the sector. The USA Healthcare Alliance has a great deal of interest in kind of the integrated feature of how health IT works together. So this is my final slide, and we take a look at healthcare upcoming events. Consumer Electronics Show has a big health piece to it, and the OHIT will be sending a representative to that office to speak in part about what work we do in the health IT sector, and that may lead to further work down the road. The HIMSS conference that I mentioned a bit earlier is happening in March, and we have a significant presence at that show. eHealth Week is the European version of kind of what's going on within health IT, both from a policy and to some degree from a market opportunity perspective. They are relaunching that after a 3-year hiatus in 2020 in Croatia. And we had an active presence at the HIMSS conference in Europe this past June, and Marta can speak a bit more about that in her comments. So this is how you get in touch with myself and Selena. We're happy to help you, and we definitely want to be assistive to your clients and companies who are looking to try to expand their health IT presence overseas. So with that, I'm going to turn it over to Marta Haustein to continue our presentation, and thank you.
Okay, so the purpose of my participation is to help you put the European market or markets into perspective. I'm calling in live from the Medica show in Düsseldorf. And so I'm going to go through a few slides to try to help make clear the differences and some of the similarities between Europe and the United States in terms of their health IT market. And I thought that it would be useful to help with two little slides that you may or may not be familiar with. The one on the left shows the relationship between life expectancy and health expenditure per capita. You can see the United States on the red line, which spends by far the most per capita in terms of health care, and yet is unable to achieve life expectancies as high as in some of the other countries. So that's one little factor that I thought would be worth keeping in mind. And the second one looks at health expenditure per capita on a worldwide map. So that you get a feel for which countries are spending the most on healthcare worldwide. You heard the statistics about the $9 trillion healthcare spending, of which around 3.5 is taking place in the United States. An additional $2 trillion is coming from the EU. So between those two markets, those can be seen as by far the largest healthcare markets worldwide. So I thought we would take a look at some of the healthcare drivers in Europe. I've identified 4 of them that I think can be considered pretty universal. The first is that there's a strongly aging population similar to in the United States. The percentage of the population over 65 is high and rising. There are going to be many European countries that have more than 25% of their population over 65 in the coming 5 years. So that's one piece of the the overall picture. The second is near universal insurance coverage, which means that the consumers, the people who are looking to receive health care, are not generally the people who are paying for it. So that, of course, impacts consumer behavior. The third are lifestyle choices. You'll see the little picture on the slide. We like a beer. A lot of Europeans still like to smoke. In Austria, it's still around 1/4 of the population still smokes. So those are behaviors that are obviously impacting health outcomes. And the final driver for health IT is simply the availability of technology. It's just ripe to be used in the healthcare sector as it has been incorporated into many other sectors in the economy. There are 2 main constraints. There are more than 2, but I would say there are 2 main ones. And the first one is the limited amount of money available to be spent in the public sector, and that impacts the amount of money that can be spent in the private sector as well, since the two play off each other, especially in Europe. And the second constraint is the question of regulation and certification. That's something that you find in the United States as well, with the certification process for different kinds of health IT technologies. That is something that can slow down the implementation, and that is in Europe tends to be even more difficult to get past those barriers. So this is something that actually Matthew already talked about today. He called it the triple aim, the IHI triple aim. Another way to look at it is called the iron triangle, where there are these 3 values that need to sort of stay in alignment, and that is high quality, universal or near universal access to health care, and cost, keeping the costs down. So that the point of this slide, and I think it's important to note this is sort of something that is on the minds of every healthcare provider and every healthcare payer in Europe. How can quality be increased or maintained? How can access be improved while keeping costs at consistent or a level that can be sustainable over time, considering the aging population. And if we look at the next slide shows a couple of maps of Europe. And this is a really cool website that I found. It's called the Health Consumer Powerhouse. And they rate different European countries in terms of various healthcare aspects. And I put up two maps. These are maps that look at outcomes and compare them to accessibility. And it's interesting because they're not identical. There are some countries that are identical in both, but the access map, if you look on the right, both of these maps actually follow the stoplight principle, where a green light means you're good to go, everything is as it should be. The yellow means caution, or there may be some significant problems that need attention, and the red color means there are some serious issues here. So if you look at the map on the left, you will see it being quite green, especially the Nordic countries, Central Europe, Great Britain, Ireland, Portugal are all very green. And those are looking at healthcare outcomes. Those are things like cancer survival rates and diabetes maintenance and so on. It's a specific set of criteria. Now, if you look on the right, you look at accessibility. And those are scores that have to do with wait times. How long do you have to wait for cancer treatment? How long do you have to wait to see a primary care physician, and so on. So you see that the different European countries are facing different challenges in their own iron triangles there. So I guess the purpose of this is to let you know that there are similarities, but there are also differences in the different markets and some of the challenges that they're facing. So this is a sort of an overview of the amount of investment that we expect to see in the coming years. There are a lot of different studies that give wildly different figures, I'll tell you right now. So I don't think anybody can really put a number on the amount that is expected to be spent on various health IT solutions in the coming time, but everybody agrees it's going to be a big amount. So we're looking at 150 billion euros, which is over $170 billion coming up in 2025, which is really only 5 years out. Germany actually recently announced a digital health regulation that is going to speed that up even more. We might need to move the numbers back so that so it's not 2025, but maybe closer to 2023 in terms of the German investment. Right now, in the EU, healthcare spending accounts for around 10% of total GDP. That compares to around 17% in the United States. And a lot of people are estimating that of that 10%, around 8% is going to be spent on health IT solutions in the coming years until they're able to reach a level of modernity, of modernness that you're already seeing in the United States. In terms of U.S. companies and technologies, I think it's widely recognized that the United States is out ahead of this. The amount of investment that took place in the United States as a result of the American Recovery and Reinvestment Act is very high. I think it's in the neighborhood of $30 trillion over the past 10 years. So there's been a lot of investment in the United States. And it is widely recognized among European markets that U.S. technologies are really out ahead of this game. So that gives us a nice in into many of the decision makers here. So we have a health IT affinity group here in Europe. We coordinate our activities. We try to stay in touch as much as we can. And we have a core team that is listed here on this slide with people from across the region. From Ireland and the UK in the west, all the way to the Czech Republic and Bulgaria in the east, and as well as Central Europe and the Nordic countries. So we're really very well represented. We actually go out to everyone in our communications, but the core team is composed of a very dedicated and engaged group of individuals who stay very, very well informed about health IT developments in their own markets, and I am very happy to be the coordinator of this team. So we are looking at achieving a few objectives in this upcoming year in 2020. They include updating a regional market research report, which is something that we did 2 years ago. We're looking to update those numbers. And rather than producing sort of a market guide that has a few pages on each market, we're looking at doing sort of an overview picture so that our clients get an idea of sort of how the different regions are developing and where their solutions might best fit into which countries. So the hope is that rather than having a very long document, that we're able to put something together that's maybe 8 or 10 pages. It's a relatively quick read for people. We are very happy to be working with a global team on the HIMSS TEPS. I'm very, very excited that David was able to negotiate a very first official agreement with HIMSS for the commercial service to support HIMSS in Orlando in 2020 in March. And we're going to be working on something, hopefully something similar with HIMSS to support their EU-wide event that's taking place in Helsinki in May. We're looking at developing a list of other shows and conferences that are maybe worth attending in Europe. There are regional shows, and there are more policy-oriented shows that are taking place in the coming year. We're going to hopefully do a good job expanding our internal and external communications. Very important for us internally is to figure out a way to improve the ability to collect metrics on Salesforce. That's something that we've really been banging our head against for 2 years. We still haven't figured out how to make Salesforce spit out the numbers we want so that we can do some decent metrics reporting. If anybody has any ideas about how to do that, I'm definitely all ears. And we're hopefully going to be able to do a little bit of team training. So now I'm very happy to introduce Robin Wiener. She's a lovely person from a fantastic company. I've had the pleasure of meeting her already, and I know you're going to enjoy her words and really get the company eye view of health IT. Robin, take it away.
Thank you so much, Marta. And we had a great time together in HIMSS in Finland, and hopefully we'll be there together again in 2020. Thank you, everybody, for having us today, and I'm very excited to tell you a little bit about Get Real and what we've been doing. But I'm going to go a little quicker than the slides, so please download the slides. We'll give you more information about our products and what we do, but I want to make sure that we keep to a good time frame here. So Get Real Health is, as you looked at Matthew's diagram, we are probably down about 7 o'clock on that circle he had there. We are all about patient engagement. It's really getting that patient excited about what they're doing for their health and connecting into the clinical world. So what we do is combine the information from home care, so everything that's happening at home, and we combine it with the clinical side. And we bring it together to give a full picture of what that person is doing. So one of our favorite lines is, see your patient like you've never seen him before, because you're actually going to see all the information that's happening at home. Most doctors only see their patients maybe 2, maybe 3 times a year. And to bring down health costs, we really need to monitor them for a longer time to keep them in line in their health plans. We do have a global install. Thanks to Matthew and Carrie and the team, we've been able to get around the world a little bit. We are up in Canada. That's probably our biggest area that we've deployed. We have our platform is deployed for 2 provinces and soon to be a 3rd one. And we have over 150,000 people on the platform right now, and it's growing about 10%, about 5 to 10% each month. So it's really expanding, and it looks like the 3rd province is going to be coming in. We're also in NHS Trust with Southampton University. We've got 13 different trusts connecting into our platform right now, and a lot of things going on in the Netherlands We've had some interesting things in Sweden. And down under, we've got some interesting things happening in New Zealand and in Australia. So we've got two products. We do have Instant PHR and CH-Base, and that combining those together makes the Get Real Health platform. And what it is, I'm going to go very quickly on this technical slide for you, but think about, all that data. And this is what data means results, and you can do something with that. And we've got a product called CH-Base, which is now deployed in multiple countries, that is kind of the ecosystem of bringing information in. We have what's called APIs that are connecting into different areas. So just think of opening up kind of a tube of information coming in from different EMRs, hospitals and doctor's office EMR information, from health exchanges, from registries, really wherever information is stored, we're going to pull it up together to this large database. And what you can do with that is do analytics, starting to look at trends, what's happening in regions, and et cetera. So we have a lot of that. And then we also look at the remote patient monitoring side of it, and we are connected into third-party applications and different devices. So now we've got all this great information, and it's coming from your Fitbit, and it's coming from your doctor, and it's coming from all these different areas. Well, the patient needs to see that all in one place, not in multiple places. It's in one place to make really good decisions about what's going on with your life. So you can take all your blood pressure readings together, all your glucose readings together, and et cetera, and you can take a look and see what your trends are. But not only you, we're going to share it back to the EMRs and to the doctors to be able to have them look at it to make really good decisions on your health. Again, Instant PHR. This is just really quickly a slide that kind of tells you what we do, what's really important about it. It's really about the remote patient monitoring around the world with telehealth, video chat, being able to securely message. And we're using these systems right now with not just for private organizations, but a lot of public, with provinces, regions, countries, and along with really being able to get into the international world by really going to where healthcare lives, which is usually with inside the government. All right. Again, this is a slide I'd let you kind of take a look at. One of the biggest things that we do is take that data and we connect it. So you've got new medication just came through. We work with in-country to find out the best education side. So we know a patient engagement platform's got to be really about that person. So as new medication comes in or new procedures, we connect to the education area to bring that information up, to match it, to be able to say, okay, my new medication, and this is what it's going to, this is kind of the information about that medication or a new procedure. So you're able to do a lot. You can also do simple things like pay your bill and get your appointment set, but really it's all about getting that information and being able to securely message your providers. What sets us apart, we're not, so this is the interesting thing about us, we're not an application. We're actually a platform. Think about something like WordPress, a GUI in the back end. So we have all these what we call Legos or pieces that you can take and create any kind of healthcare application you might need. So it can be focused country, like as a region-wide, so just a patient portal kind of feel to it, you're getting the information, or you can add pieces to that, that piece and add in care management. You can add in alerts and reminders. You can add in surveys, health journaling, all these different information. So we look at a use case and able to take the pieces to build up that use case. And it's been really great. The other thing we can do is you're never going to know it's us. It's always skinned with, if you go to province of Alberta, Canada, you're going to actually see skinned Alberta, eHealth Alberta. You're never going to see our name in there. One of the biggest reasons we're international, we can do multi-language around the world. And we can deploy it as a hosted one in the cloud, or we can deploy it on-prem. These are just a list of all the cool different devices that we're connected into. It's so easy. You connect it once and that information flows. Apple Health Kit, which actually will give you a bunch of other devices. Information will come up to OnRun, Fitbit/Google, iHealth, Witherings, and et cetera. So it's a really great, but just think you've got all the stuff that's going on in the hospital, but all the stuff that's going on at home, and bringing it together in the language that you are in country. So important, government regulations. We comply with all the ones here in the United States and other countries. What we usually are able to do is take the base of what we have in the United States, working with the teams overseas, figure out what the delta is, and increase our platform to match that delta in each country. It's so important to understand those. InfoVal, we're on the top of all the newest technologies to be able to connect areas together. And I think the most important thing is we really are very careful about security. Security, security, security. This is just a great way to kind of, that what we have in languages right now. We have multiple languages, but see some of the more interesting ones is Japanese, Chinese, and Spanish. It's interesting because you can do characters, not just words, and be able to do it in their culture. Their multiple languages, a unit of measurement for every single one in Western and non-Western languages. This one's a kind of neat one. This is why we've got a lot of things going on in the Middle East right now, is that we've got, if you look at the one on the left, you'll see a young man's picture on the left side in English. But when we flip it to Arabic, his picture flips too. So now instead of going left to right, it's right to left. And that has just completely opened up the market for us. And that's something I always suggest to new companies, is make sure you've got that kind of ability if you want to go international. CHBase, I think we've talked a lot about this, but the big part of CHBase is this ecosystem that we're building. So it's going to be ecosystem of information. So not only are we connecting into the different EMRs and health exchanges and et cetera, we also give it a platform for any entrepreneurs that might be in your country. We know that we love our instant PHR, but somebody in a garage somewhere is building the coolest, neatest thing ever, and we want them to be part of our platform. And so we have a CH-based developer sandbox so that anybody can come and add that into it. Because when we go into countries, we want to make sure that the ecosystem not just includes U.S.-based products, but we also want to be able to include whatever country we're in, that those developers are part of this really cool ecosystem, especially when we're doing something as large as in a province or region, where we're really pushing it out to millions of people. In Alberta, we just went live about 4 months ago, and we've got 150,000 people 100,000 people on that site right now, but we're growing by 10,000, and they've got about 5 million people there. So we want local companies to join this really cool ecosystem. So we want to open that up. Again, just so you can take a look at that. I think the reason the customers buy CHBase is really all about being able to be part of that ecosystem. So we'll take a look at that. I'm looking at time here. International growth right now for us. We've got a lot of things going on in the Middle East. We've got a big opportunity in Saudi Arabia, and a lot of things in the UAE and Kuwait. And the reason why we're in the Middle East is, first off, there's a ton of business there right now. There's a ton of business for health IT. The other side of it is we're lucky enough to have it in Arabic, so it really does open that doors for us. So we've got great partners there, and they're bringing us to market. The next thing is we've got in Europe right now, it's one of the best markets for us. The Netherlands is just blowing up. We just did a large pilot in the Aquahook region and just got certified as Med-in-Need for being one of the first patient portals to do that. United Kingdom, again, we're with Southampton in the NHS Trust and just growing like crazy. And Sweden, we had a big opportunity in Sweden, got kind of shut down with the government at the last minute. We've been working with your embassy over there, and hopefully that will get restarted. Again, why is Europe good? It's just the right market for us, the right size. Everybody is really passionate about getting patients involved in their health care. And what we've done in Canada is really matched to what we're doing in Europe. I'm sorry. North America, I think we know in the United States we've got a lot going on. We just got acquired by a large company, and we have 1,200 hospitals that we're going live in. And in Canada, I've talked a lot about what's going on in Canada. In Mexico, we have a large opportunity in Mexico that hopefully we'll hear in the next week and a half. It's supposed to be Black Friday, we'll find out, and hopefully it's a really good deal for us. And again, we're here in North America. It's very easy for us to get everywhere, but also the other side of it is Canada is really booming right now in what we're doing. And the last area is Oceania. We have a lot of things going on in Australia. There's a new RFP that's going to be coming out in the next year that is a good match for what we've been doing in Canada, and in the UK might be a great match in Australia. And we got a great partner down in New Zealand that's kind of helping us. Go ahead. So that's why it's a good market. Key challenge of international growth, what we've learned a lot. Lack of sales staff, not understanding the cultures, not understanding all the different regulations and rules, and being able to understand the privacy concerns and the Patriot Act, which was a big thing we had a problem with in Sweden, which the team here really helped us get through. And the other thing, the economy, the pricing is very different from country to country, and especially when you go into emerging markets, what that looks like. Being able to deploy through all those different softwares across the world, and of course networking. And the way you guys have helped us in this is the lack of sales staff around the world. You've opened doors, you've introduced us to different companies that be able to help us establish relationships around the world to expand our team. Understanding the culture, a great experience I had was when we went to Finland for HIMSS 2.0 there. They had just a fantastic papers to us, explain to us how you should work with people from Finland and what the Finnish are used to talking about, and how there's a culture in general. Regulations and rules, healthcare, we kind of got in trouble in Sweden, and we should have come to you guys beforehand and make sure that we were in line to what they need. Privacy and concern, Patriot Act, again, I go back to Sweden. That was a major question, and having you guys support us to be able to say that the data stays in country or in region, extremely important, and the United States is not going to touch it. Again, understanding the economy and pricing in each country. Between Canada and Mexico, there are complete different pricing. We had long discussions about India and what that looked like, so really that side of it. Deployment of software, again, partnerships, being able to expand what we've got, and then networking, just general networking. Having us come to events, I've been able to speak multiple times at different embassies here in the U.S. We're located in Washington, D.C., makes it a little easier, or overseas, and that's something we want to do more of. To talk about health IT as an export in the United States. I had the honor of speaking at the White House during Obama's administration to kind of talk about that, and it was a really great honor to be able to do it. And I just want to say thank you, and thank you to the team. Matthew and Carrie have been just such great partners to us, and Marta, I mean, it's just been a great experience, and I think you guys are an asset to all small companies or large companies here in the U.S. Thank you very much.
Great. Thank you, Robin. Folks, we have a couple minutes left if you'd like to ask some questions. I don't see any in the queue currently, but please use the Q&A chat pod to let us know if you have any questions for our experts. Definitely take advantage of our speakers here in the room to answer all those questions you may have. And if not, we'll follow up with you via email after the webinar. David, Matthew, Marta, any closing remarks as folks are submitting their questions?
This is David. I guess I'll just want to take a quick moment to thank Robin, Matthew, and Marta for joining this program and providing your expertise. Robin specifically taking the time to help train us internally about what's important to you and your journey is invaluable. So many thanks for that. To everybody listening in, as Matt said, if you don't have any questions now but think of something after this program, please don't hesitate to reach out to any one of us. We want to be here as a resource to be helpful and hopefully have more people like Robin across the country that can sing our praises of their success in international markets. So that's all from my side. Robin, Matthew, Marta, anything else to add from you guys?
This is Matthew. Just a couple of things. One is, again, thank you to Robin, particularly for that great overview of your company, and we definitely want to have many more Get Real Health examples like Get Real Health in the future. I should also mention that we have a Health IT Industry Focus Group that I co-lead on the INA side with Leanne Hayworth of CS Pittsburgh on the global markets, CS on the domestic field side. Michelle Willette's also a great resource. So there are a number of people who are on this call, who are in our ecosystem, who are very active, who've worked with companies like Get Real, small, medium, large-sized enterprises throughout the country. We look forward to trying to help more of these companies increase their exports globally and also address any market challenges and conditions that may make it harder for them to do business. So please use all of us as resources, and we'll connect you with the right folks. And again, thanks for the opportunity to speak. This has hopefully been very educational for everyone.
All right, we did have one question come in for Robin. So Robin, what is the biggest barrier when looking to go into a new market with your product?
It's usually kind of understanding if there's any RFPs or any interest in that area. That's why we usually come and try to figure out a partnership there. But it is always difficult to find out what is the business need right that moment that we can kind of connect into.
Excellent. So that's all of our questions. We can go ahead and wrap up here. Well, big thanks to our presenters for today, David, Matthew, Marta, Robin. Excellent presentations, and thank you everyone for your participation today. Please mark on your calendar our next Export Factor webinar will take place on December the 4th at 2 p.m. Eastern. Please note that that's actually on a Wednesday as opposed to our usual Tuesday session, so mark that accordingly on your calendar. And our topic on that day will be Misadventures in Standards, presented by Braden Young and Sarah Cook. That'll do it for today. Thanks again, and take care.